Well, variants are in large part driving the third wave of the pandemic as we know it. New analysis by CBC News has found that as their numbers grew in Canada, many officials either did not notice or did not react with enough urgency to head the variants off. Jorge Barrera is on the story for us, and he joins us from Gatineau. Good morning, Jorge.
Good morning, John.
Let's talk about CBC News and the analysis that we did. What did it show?
All right, well, this analysis basically showed us a tale of two curves. The first curve, the overall COVID-19 case count was starting to drop from its second wave peak in roughly around the middle of January down through February and into the early days of March. And as this curve was dropping, provincial leaders started to loosen restrictions. But in the underbrush, these variants of concern were starting to move. And as they started to move is when provinces decided to loosen restrictions. And here's how an expert from Simon Fraser University described what happened.
People were so used to looking at the total cases and the idea that something small could be rising quickly while the entire picture looked okay because of those 300 or 500 cases a day. Very few of them were variants yet. Or the idea that we don't see a problem yet, or we don't see a problem at all because it's only 10 or 20 cases here and there. But it doesn't take long if they're doubling every week or two for those 20 to become 40, 80, and hundreds quite easily.
Now there's over 100,000 Canadians who've been infected with these variants of concern, and it's hitting young people harder and putting more into hospitals. But provinces were warned. Canada's Chief Public Health Officer Theresa Tam warned about this in mid-February, as is Ontario's Science Advisory Table, that these variants were transmitting at a higher rate. We shouldn't loosen restrictions. Restrictions were loosened. The variants broke through this window, and now we're in the midst of a third wave propelled by these variants.
Okay, Jorge, has anything changed so far?
Well, provinces have ramped up their screening of these variants, and the screening basically allows you to detect the variants we know about. We've also seen an increase in genome sequencing. It's gone from 5 to 7% to about 10 to 15%. And what this sequencing allows you to do is not only detect the variants you know about, but also mutations that you don't know about. And also now we actually have a portal that allows for pan-Canadian, almost real-time virus data sharing. We didn't have that before because each province was doing its own thing. There was issues about privacy and sharing of information. Public health labs and research had to go to international portals to upload their data and bring it back down to get a semblance of a Canadian picture. But now we have a pan-Canadian portal powered by Genome Canada that's going to allow public health officials and researchers to not only detect what's happening, see what's happening, but also anticipate what could come. And what could come is that experts are worried about these vaccine resistant viruses. And because Canada has such a variant, high variant rate count and also a rising vaccination rate, you're going to have variants bumping up against vaccinated hosts. And this could very well spin off one of these mutations, or it could come from another part of the world. But experts hope that with these new measures, we're going to be able to detect them and clamp down on them should they emerge. John?
Thanks for this, Jorge. CBC's Jorge Barrera reporting in Gatineau, Quebec.